Cisplatin-based chemotherapy remains the standard of care for the treatment of muscle-invasive bladder cancer. Despite that, relapse rates are high, and only approximately 50% of patients experience long-term durable survival with cisplatin-based chemotherapy. So clearly we need to do more to enhance the clinical outcomes for our muscle-invasive bladder cancer patients. Pembrolizumab is a checkpoint inhibitor which has shown significant promise and is currently approved in the second-line treatment of metastatic bladder cancer and in the U.S. for frontline patients who are platinum ineligible as well. The hope is that by combining pembrolizumab with chemotherapy, with gemcitabine cisplatin, we can enhance the tumor response by reducing the tumor, perhaps increase antigen presentation or antigen release, stimulating a better immune response that can then be treated with pembrolizumab to enhance our immune control of urothelial cancer. The goal of the KEYNOTE-866 trial is to see if we can improve the response rate for patients receiving chemotherapy with pembrolizumab for muscle-invasive bladder cancer. We will also be looking at event-free survival as a co-primary endpoint to see if the combination of treatment will enhance the long-term outcomes of patients with muscle-invasive bladder cancer. Patients must be eligible for platinum-based chemotherapy and, of course, must have a muscle-invasive bladder cancer. So those are the two major criteria. You need to have good kidney function in order to tolerate platinum. You also need to have good heart function to be able to tolerate the fluid load associated with cisplatin-based chemotherapy. As far as biomarkers regarding response to therapy, PD-L1 is the most frequently used biomarker. Despite that, we don't know how PD-L1 expression behaves in the setting of muscle-invasive disease, and we also don't know how the impact of chemotherapy with pembrolizumab will impact outcomes in PD-L1 high and PD-L1 low tumors. There's some thought that the use of chemotherapy may enhance the antigen load associated with these tumors and enhance the response, even in the setting of low PD-L1 expression. So it's possible by combining these two agents together, we may overcome the limitations associated with PD-L1 expression alone.